siguro yung sa akin lang kasi maraming tao yung nangangamba sa report na parang may uptick ulit slide sa COVID cases. Should this pose as an alarm, lalo na ngayon na may binabantayan din na influenza-like illnesses? Ano pong message po siguro o clarification ng DOH para hindi ma-alarma yung public?
Thank you for that question, Christian. So let me now explain what has happened. No? Binabana natin yung public health emergency. Ang COVID-19 is now just one of the illnesses, many illnesses that causes acute respiratory infection. So monitor pa rin natin yan. We're still doing epidemiologic surveillance and through tumataas yung cases. And hindi naman, it's a mild, it's a minimal, actually ang tingin nga namin minimal increase of cases. So the warning, the public health warning is the same. During the season, mataas ang incidence ng acute respiratory infections kasi maraming party, maraming family reunion, maraming tao sa shopping mall, maraming tao sa public places, correct? So talagang the risk to get any respiratory infection is high, including COVID-19 cases. Now, hindi na tayo as worried, and I'd like to tell this in public, we shouldn't be worried about COVID-19 anymore because according to our infectious disease experts, the most recent variants of interest are just like the common colds and cough, no? Common colds and flu. Ano lang siya, upper respiratory infection. Unlike yung earlier variety na nagkakaroon ng severe pneumonia and they die in the ICU. Now, that doesn't mean hindi siya dangerous because even common colds and cough or acute respiratory infection ay pwedeng maging masama sa isang taong elderly na mahina ang immune system, sa isang taong may bata pero madaming comorbidity, may iba siyang sakit. So, pwede rin ma-hospital because of that. And yun nga yung naging report, Christian, sabi nila napupuno na yung COVID beds. And ito yung na-alarm sa amin. But you have to remember, nung in-analyze namin, nung kasing nawala na ang COVID, ang mga ospital, kinontian na lang yung kanilang COVID-allocated beds. At binamihan, yung para sa iba. Para sa mga may diabetes, may high blood, may sakit sa puso. So yung sinabing napupuno na yung allocated. Pero that doesn't mean, konti pa rin yun. In our total statistics, it's still not as much higher than kahit compared to the similar months last year. So, yes, there is a slight uptick. Yes, some hospitals said na puno yung COVID beds nila. Pero ang context nun, kumonti na yung COVID beds kasi. So, tandaan natin maraming ibang sakit. There are many other illnesses other than COVID. And yun ang ating i-focus lahat. Let's have a more inclusive approach na lahat ng sakit bantayan natin. Hindi lang COVID-19.
Isang follow-up.
So as a final note, may mga ibang hospital nag-implement na ng stricter masking. So pag pumasok ka ng PGH, re-require nila magsuot ka na ng mask. But that doesn't mean magre-require ang DOH na dito, mag-mask tayo lahat. Hindi. So it's only because ikaw, bisita ka sa ospital, madami na dumadami COVID, baka mahawa ka. So it's for your protection that they're telling you, mag-mask kayo. So ito yung ginagawa ng healthcare facilities para tumaas, para ma-protect yung people entering there.
Thank you very much, Secretary Herbosa and Mr. Christian Muslims. I believe that also answers the questions of Ms. Giselle Ambal of GMA News Online and Mr. Luisito Santos of PZWB. Moving forward with our next question, I call Brett Bayonweda from Philippine Star. Secretary, Brett Bayonweda from Philippine Star. I would just like to ask, are you pushing through with our plan to avail of the monovalent XBB vaccine? And if yes, what is the initial amount we plan to purchase?
So let me just say, in the budget, wala kaming nilagay na COVID-19 vaccines, no? We've vaccinated 74 million Filipinos with primary doses and booster. So, and then marami yan, about 5 million Filipinos got infected through natural immunity. So higher than that, sigurado ang mga immune na Filipino against COVID-19. So hindi kami budget or ng new vaccines, because the vaccines, remember, are still experimental, so we are awaiting the final registration before we will procure them, and even with the assessment of our health technology assessment. However, merong new vaccine formulation, yung tinatawag na monovalent XBB, and we've been offered 1 million doses, and I'm accepting it from COVAX. I'm accepting it in tranches of 500,000 para magkaroon din tayo ng access. Remember, yung vaccine ngayon, hindi na kailangan ng buong population kasi marami nang nabakunahan. So, sino ang dapat bakunahan ng XBB monovalent? Of course, yung senior citizen, yung at-risk population, the senior citizens and those with comorbidities. So, kung ikaw, young individual, meron ka ng COVID-19 vaccination, hindi mo na siguro kailangan ng another one. So, we will watch this kasi meron ding reports in the science journals na baka parang flu siya. We may have to keep giving it because the virus mutates. But in the meantime, hindi pa tayo certain dyan. But there's no budget for COVID-19 vaccine. I think what I will emphasize sa public is hindi vaccine ang solusyon. We learned the solution. It's minimum public health standards. Again, managing your own personal risk. So ito yung na-change na narrative, no? During the pandemic, the government tried to protect everyone, blanket. Now, it's back to individual-based risk management. Ano ibig sabihin nun? Kung ikaw high risk, ay ba't ka pupunta sa risky behavior? Ba't ka pupunta sa ospital at walang mask, di ba? Hindi mo gagawin yan, di ba? Kung ikaw merong ubo, sipon, ba't ka pupunta sa party? Huwag kang pumunta sa party, huwag kang pumunta sa school. So yun yung approach ngayon ng Department of Health, individual risk. Kung ano ang mga risks mo, yun ang bantayan mo. And each person, iba-iba ang kanyang risk.